I'm Dr. Scott Fuller. Let's talk about reducing blood pressure with some simple steps. And I have a couple of examples here that some cases that worked out well. So I'm going to give you one that's going to be brief with a couple of things that we did that worked out tremendously for this man. And then I'm going to give you a little bit more of a longer strategy as the second part of this segment. So first thing, the medical disclaimer here. Don't do any steps here that I'm talking about unless you check with your doctor. Never make any changes to nutrition, to supplements, to exercise. Never change any medications that you're taking and so forth until you check with your doctor. So don't do anything here until you talk to your doctor first, okay? All right. So my patient John, he contacts me. He's 67 years young. And he said, this is back in July of 2020. And he says, my blood pressure in the morning is 160, 170 over 110 to 115. That's not good, right? That's not good. And he said, that's not good, yeah. So what can we do about it? He says, what do you have? I said, well, let's start with some simple things first and see what kind of a change that we can make. He's all on board. He did the hard work. Check this out. First thing I said was, no late night snacking. He's like, oh. He's a night owl, right? So he'll have dinner late and then he'll snack late, right? All kinds of problems with that, which I'm going to talk about in a few minutes. I said reducing alcohol, so we talked about that. Drinking alcohol is like drinking pure sugar. Sugar in the evening is going to spike insulin responses, and then you get a sugar crash, and then overnight the brain is going to say, I'm out of sugar now, I need more sugar. It's going to release cortisol, which is going to start waking you up, and then you get an insulin response, and so then in the morning your blood pressure goes up, and actually your blood sugar can go up depending on what's going on in the evening, so that's terrible. Then I said the third thing would be 10% more vegetables in all meals, and a 10% decrease in the size of dinner. Again, we're not trying to backload the day. In America, we tend to have big dinners, right? A lot of other countries are big lunches, smaller dinners, way better way of doing it. Don't fill the tank up full of gas and then go to bed, right? And the last one, we started them with magnesium. Now, magnesium is a supplement that is a muscle relaxer. What's the heart? Muscle. What are all the arteries and arterioles? They're tubes of muscle. And if you have more sympathetic tone that contracts things, and you have less parasympathetic tone that relaxes things, that's going to keep the peripheral resistance up, increasing blood pressure. If the heart's working harder, blood pressure goes up. Magnesium tends to settle the nervous system down, more parasympathetic tone, and then more relaxation of muscles, right? So check this out. That was July. 1 month in August of 2020, he has the lower diastolic reading, the lower number, after doubling his magnesium, and he was taking two magnesium tablets. You can look at my other shows for that, 2 in the morning, 2 at night. 4 months in, so now November of 2020, his blood pressure is now down to 135 over 87. Now remember, it was 160 to 170 over 110 to 115 just 4 months prior. That was the lowest reading in the morning that he's had so far since doing these simple steps. He was working really hard not to eat late. That was his challenge, but he did it. He did the hard work. 5 months in, December of 2020, he said, my blood pressure is now 130 over 75. And at the end of December, 125 over 77 in 5 months with 4 steps. That's so cool. Now check this out. Over the holidays, December into January of 2020 to 2021, he broke off the program. He was eating more late, and sure enough, blood pressure went up. He cleaned up his act after that, and it came back down. He's like, of course, this is exactly what I need to do. And just a couple of other side things that he told me he was doing. He said, I'm eating sauerkraut for probiotics, and he took red yeast rice. Some of you can look into that supplement here. Let's look at the 4 things that he did. It was no late night snacking, smaller dinner by 10%, increasing the vegetables across all meals by 10%, reducing alcohol is another thing he did, and then magnesium. He took enough magnesium and he got there. He got to his goal line. I mean, that's an incredible reduction in blood pressure with no medication in 5 months. And now he's going to do it. He's like, I'm completely motivated. I want to be around for a while, he says. Okay. So the next thing is a very good friend of mine calls me and says, hey, My dad's not in a good spot. His blood pressure is terrible. It's way worse than the case I just told you, sometimes approaching 200, sometimes over 120. He's under medical care. He's already on medications. They want to up his medication and so forth, so they were looking for alternatives, and they turned to me. So we did 8 things. 8 things. I don't have any results yet on this because we're just getting started here in February of 2021. So I gave him very similar things. Number 1 is no snacking after dinner. Now this man in his 80s, he's a diabetic. He might have to have a little bit of something before he goes to bed just to equalize the blood sugar. And I just made the comment, make it as small as possible to get that number where he needs to go. Number 2, reduce the size of dinner by 10, and I actually said to 20%. 10 to 20% reduction in the size of dinner, and increase vegetables by 20% across the board. When you're increasing vegetables, you're decreasing fat, you're decreasing protein, you're decreasing sugar, you're getting in fiber, you're getting in micronutrients, you're doing all those things, right? Number 3, I asked about water. So I've talked a lot about water. You can go to my water video on my YouTube page if you need to. And I said, get your water up. We need to know where he is now, how many ounces you're taking in now. And I said, we've got to get him to at least 64 ounces. He doesn't have to drown himself, but let's know where he is now and let's up that. And of course, in there, this is very important. I tell people you've got to start drinking water first thing in the morning, drink most of it in the morning and the afternoon, and before dinner, and then after that trickle it down, because if you're loading up with water before you go to bed, you're going to disrupt sleep because you have to get up more to go to the bathroom. Number 4, this is important because this is going to deal with the sleep-wake cycles. No caffeine after breakfast. And I did learn that he was having caffeine breakfast and sometimes at lunch. Now we might think, okay, I'm not having any caffeine after lunch, but that still for a lot of people might not have enough enzymatic clearance of caffeine before you go to bed. So that will affect sleep in the evening and you might not even know that it is. So I said limit caffeine only to the morning, not after the morning. And I did a long video on sleep and some sleep recommendations. You can go to my YouTube page for that. Number 5, he was taking magnesium, but we want to make sure he's taking the right form of magnesium and enough milligrams per day. They're going to look at that. I sent them the video on magnesium as well, so they can check into that and evaluate that. Let's see. I also said consider a berberine supplement, and that's a blood sugar regulator. Again, do not start any supplements without checking with your doctor. Check with your doctor before magnesium, check before berberine, whatever it is. So they're going to look into that. Number 6, exercise. When we talked about exercise frequency, and I made the recommendation here, and I said, I don't recommend exercising every day. Only exercise on the days that you eat. So that was the exercise recommendation and the exercise frequency, right? Number 7, I said, remove all stress from your life and never let it back into your life ever again. I sent them a copy of my stress video as well. Reducing stress is going to bring into that sympathetic parasympathetic balance. If we're always in fight or flight, we're going to get that sustained sympathetic atonia, which means that the sympathetic or gas pedal is going to be cranked up a little bit more, which is going to increase the heart output. The heart's going to work harder. Peripheral resistance goes up as the arteries and arterioles stay a little more constricted. And then you're not going to affect sleep-wake cycles, so you're not getting the restful, rejuvenating sleep that you should get. So that's going to be a problem. Let's reduce the stress as best we can. And of course, chiropractic care. And as I've said before, there are 2 great research articles on reducing blood pressure with chiropractic care. You can certainly check out my information to learn about that. There's a couple of good studies. One study was in 2007. They did 1 adjustment here. By hand only, not a manual adjustment. 1 adjustment reduced blood pressure for 8 weeks, 1 time. And the second chiropractic research article on reducing blood pressure was just a light force instrument in the upper back area, 1 treatment. Now what was great in that research article was they took a group that received nothing, control group. They received, a second group received a sham chiropractic adjustment, not the real one. And the third group received the real chiropractic adjustment with the instrument, and the only group that showed a measurable and significant blood pressure decrease was the group that did the reduction in blood pressure. So there are some strategies that you can talk to your doctor first and see if you can get your blood pressure down. Normally and naturally, it's going to increase your quality of life, reduce the chances of all the other problems that come with sustained high blood pressure. I'm Dr. Scott Fuller. Thank you.